Next up, we have Dr. Jeff Wilder, representing the Wisconsin Chiropractic Association, speaking against.
Good afternoon, members of the committee. Thank you for the opportunity to testify. My name is Jeff Wilder. I've been a chiropractor in Madison for over 42 years, but I have a lot of extra experience with work comp. I teach Wisconsin chiropractors the rules and regulations of Wisconsin workers' compensation. I teach them how to assess disability. For 23 years, I was a paid expert to the department adjudicating disputed work comp claims. I'm here to testify against the fee schedule portion of LRB 5293, but in no way am I testifying against the PTSD portion. My father was a Madison firefighter, and I am thrilled to see all the uniforms in attendance today. The Wisconsin Chiropractic Association believes that the current system of reimbursement in work comp is fair for all parties. I did provide some written testimony with some graphs and some quite specific numbers. If you have that available, let's look at number one, please. Wisconsin work comp total cost per claim with greater than 7 days of lost time was 5% below the median of the 17 studied states in the most recent WCRI study. Of that, the medical costs were 61.8%, the indemnity costs were 27.1%, and the delivery expenses were 11%. And I've heard some testimony today thinking, that's shocking that there should be that much medical cost. Well, remember that work comp has existed for 110 years in Wisconsin, primarily to pay doctor bills and hospital bills in a no-fault context for injured workers in Wisconsin. So the fact that 62% of the average cost goes to medical bills should not be surprising to anybody. If you take a look at item 2 on the next page, Wisconsin was tied with Iowa for the shortest temporary disability per claim. That indicates a quicker return to work. Number 3 on the next page, Wisconsin had the lowest indemnity expenses among the 17 states, and that shows that there was improved clinical recovery of the injured workers. Wisconsin had the lowest friction costs or benefit delivery expenses. These would be medical cost containment costs and litigation costs. This indicates that the injured workers had a higher satisfaction of their treatment. If you go to the next page, line 5, medical payments per claim actually decreased in Wisconsin by 1.1% over the 3-year study period. And on line 6 on the next page, in the context of overall inflation, our medical prices went down in this 3-year period when the consumer price index went up 9.5% aggregate in the same 3-year period from the Bureau of Labor Statistics. There's been some talk about the current cost containment system, but not very much, and I think some of it was not quite right. So I want to really talk a little bit about the cost containment system that is currently in place, how that came to be, and how that works on a daily basis. Okay? Mr. Grappentine talked about the liaisons being invited to the Work Comp Advisory Council in the early 90s, and that's when the providers actually put together a proposal that is now our current fee reduction schedule. And the way that it works, you can see it on the graph here, is that the department approves 4 different databases to look at provider cost data and provide that information back to insurers. So essentially what happens is all provider cost data is captured within the system. That information is provided to insurers who have algorithms that can cap a provider's cost at 1.2 standard deviations from the mean, and that's shown by the little, on my copy, it's a little red mark at the bottom of the graph. So what this means in practice is that if I have a procedure in my clinic and I charge $50 for it to a work comp insurer, that will be reviewed in the context of cost data for all providers doing that same procedure. And if my cost was $50, but the 1.2 standard deviation was, say, $42, my payment from the insurance company would be $42. And on the explanation of benefits, it would point out that I got a cost deduction for being outside of the database. And this happens to providers all the time. So what this allows for is that providers can raise their price in accordance with inflation, but if they raise it more than their peers, they get cut off. And this system has been in place for 30 years, and it's worked quite well. So the idea that provider costs are uncontrolled is really simply not true. This system has been in place. It's regulated by the department, and it's worked very well. This allows providers to change prices according to inflation or as their clinical needs change, but it does not reward price outliers. It attacks price outliers. On the contrary, any government-mandated fee schedule will have unintended consequences. The WCRI data is full of information that shows that when states adopt fee schedules, they lose the best providers. The states then have poorer outcomes than Wisconsin. They have delayed return to work and poorer outcomes overall. It's important to notice that price control does not control the overall cost because the doctors and the hospitals still control what services are provided, the selection of services. They determine the duration and frequency of treatment. They determine patient education. They determine the return to work, total temporary disability, and permanent partial disability are all determined by the doctors. I can tell you, with all of my experience with Wisconsin Work Comp, I feel that the doctors have done a terrific job of being non-partial in these sometimes hotly contested cases, providing only the care that's necessary and returning the patient to work as appropriate. If there are cases in which there is permanent disability, it's been my experience that the doctors have been very competent in doing that in conjunction with Wisconsin's proprietary disability system. It's also important to point out that in most of our daily lives, if we want to save money, we can buy less. I can go to a restaurant and maybe I don't order the full portion, maybe I order the lunch portion and I save a couple dollars. We can't really do that in healthcare because we have a standard of care. And so we do provide the same service for every person. And if that is suddenly paid less, that's going to put a strain on all healthcare providers. I heard earlier today that a work comp claim is equatable. It is completely equal to a group health claim. And that's patently false. Almost all work comp claims are acute. Almost all of them are more severe than a gardening injury, sometimes involving heavy equipment, heavy machinery. The doctor involved with a work comp case has to manage work restrictions, disability, assess for permanent disability, and as was previously mentioned, in group health contracts, they can steer thousands or tens of thousands of patients to providers and should expect a discount for that. But that's not in any way how Wisconsin work comp works. There are other opportunities to improve work comp or to reduce costs. You heard it mentioned to reduce injuries. Every accident is preventable. Every accident is preventable. And we simply need to do a better job with that. Other administrative things that could be done would be to include work comp claims in statute 628.46, which deals with timely payments of clean claims. Shorten up the window of time for an injured employee to make a work comp claim. It's currently 30 days in Wisconsin, and it's currently 2 years for repetitive injuries. We could require insurers to determine the work-related liability within a set period of time, perhaps 30 days. We could cap or limit the administrative fees and the profit charged by the work comp insurers. Currently, it's 11%. That seems high to me. We could perform audits of the certified databases. We could streamline and have only one certified database. We could require training for doctors who do permanent partial disability ratings. So, in summary, the most recent data that we have from WCRI shows that Wisconsin's system leads to superior clinical outcomes, the shortest return to work times of any studied state, and total costs that are below the average because proper care reduces the other costs. It reduces the indemnity costs and reduces the friction in litigation costs. Thank you for your time. I'd be happy to answer any questions that you might have.
All right, thank you for being here and for your testimony here today. Questions from committee members? Seeing none?
Thank you very much.
Next up, we have Laura Leitch from the Wisconsin Hospital Association speaking against.
You get two of us. I hope that's okay.
Whenever you're ready.